Another high-yield MSK question that's coming in your step 1, so pay attention. A 45-year-old gentleman presents with right shoulder pain and weakness after falling on an outstretched arm. He's unable to abduct his shoulder beyond 15 degrees. Now that's very important, pay attention. So strengthen, inflection, and external rotation are preserved. Which nerve is most likely injured? Okay, so this is typical of step 1. They never want to know the muscle that's affected, they want to know the nerve that innervates that muscle. So, very typical. Choice A, accessory nerve, incorrect. Accessory nerve is the 11th cranial nerve, the only one with purely motor innervation. It innervates the sternocleidomastoid and the trapezius muscle for shoulder shrugs at the gym. Now, the trapezius actually does play a role in abduction, but it's only after 90 degrees. So that the problem is obviously after 15 degrees, so it wouldn't be our answer. Choice B, suprascapular nerve, incorrect. Suprascapular nerve innervates the supraspinatus muscle, which is responsible for the first 15 degrees of shoulder abduction, which we can tell from the question. It is he can do that, so that's not our issue right now. So choice B is incorrect. Choice C, musculocutaneous nerve, incorrect. It's responsible for the innervation of the biceps and the brachialis for elbow flexion. And choice D, axillary nerve. Now, this is the correct answer. Axillary nerve innervates the deltoid muscle responsible for abducting the shoulder from 15 degrees to 90 degrees. So yes, choice D is the correct answer. Choice E, long thoracic nerve, is incorrect. Long thoracic nerve innervates the serratus anterior, also responsible for shoulder abduction above 90 degrees, and it's also responsible for scapular rotation. But our problem is with shoulder abduction above 15 degrees. That's our cut point. It's not 90 degrees. That's why choice A and choice E is incorrect. So choice D is correct answer. Thank you guys for watching.